Family Development Podcast. I'm Gretchen Hunter, a licensed psychologist, and I'm joined by two colleagues who are really interested in providing services to children with pain syndromes. I'll let them introduce themselves.
Hi, I'm Tiara Glenn. I'm a licensed clinical mental health counselor associate here at Child and Family. I'm really excited to be here and talk about pain.
Hi, I'm Jessica Turchin. I am the physical therapy supervisor here at Child and Family Development, and we have worked really hard to build a program to address a concern that a lot of children face for a really long time without being able to find resources to help them.
So we're going to talk about something that I think is really interesting from my perspective as a psychologist, the idea about pain and not just short-term pain, but chronic pain syndromes and how those show up for kids. And there's one specific one called amplified musculoskeletal pain syndrome. And to Jessica's point, this can be really hard for families to seek out an accurate diagnosis, and there's often delays in accessing specialty care that can really understand and start effectively treating. So to start off to these two, what is AMPS in a way that can be easy to understand for families?
Yeah, AMPS is a condition where the body's pain system is really just overactive. The pain that your child feels it's not coming from ongoing injury or damage, but instead it's really their nervous system that's amplifying their pain signal.
I often explain it to kids like the pain is a volume knob, and normally it's set at a low level and you can tolerate a little bit of pain and it goes away and you can function. Children with AMPS, the volume knob to the pain is turned up, way up all the time, even though there is nothing physically damaging happening to tissues in their body.
Right. And that's important for parents to hear too, because it really is like this knob is turned up and their nervous system is on high alert. Your child's not making it up, right? It really is that they feel this pain at a really high level, even though, like you said, there's no injury there.
So why does it still hurt if there's nothing wrong, right? I mean, injuries happen and they heal. Like what is the mechanism for this?
Yeah, I think that for a lot of people, you think pain equals injury, and that's not necessarily the case. Your brain and your body can get in this loop where pain signals keep firing, even though the original cause or injury is healed, it's gone. And things like stress or anxiety, illness, injury, high demands in school, growth spurts, all of those things can cause triggers for this pain signal.
And once this loop of pain kicks in, kids often begin avoiding movement because it hurts. This avoidance of movement, this pulling back from everyday life and everyday function actually makes the system more sensitive over time. And so the cycle begins, there is pain, children avoid movement, there is less movement, the whole body becomes weaker and more sensitive to the pain. This increased sensitivity to the pain increases their pain even more. And this is the amplified cycle of this pain, is that it keeps on going until we can figure out a way to break the cycle.
That makes a lot of sense. I mean, right? If something hurts, you don't want to, like, if your ankle hurts, you don't want to step on it. That's a good way for kids to kind of follow what their body's telling them. But in this case, like, you don't want them to follow what their body's telling them. And so I think that one thing is really interesting and sort of inverted, that like how is exercise and why is physical therapy such an important part of this treatment?
This is a great question. We talk with parents about this all the time. Having an accurate diagnosis is key because obviously we do want to ensure there is not physical tissue damage happening to any part of the body. So we do want to make sure we're doing a full, thorough assessment to get an accurate diagnosis that this is truly what your child has. Once we have that, we actually use exercise to retrain the nervous system of how it should be processing movement. And so by educating both child and the family that movement is safe. This is good for your body. This is going to retrain how your brain is processing this information. We can say this body part is safe. You are safe to move it. You don't need to up the pain signal because this body part is moving. Specifically, we spend a lot of time doing cardiovascular exercises because the increased blood flow through the body helps open up blood vessels, which does eventually start to decrease one of the main sources of pain, even though it's hard in the beginning.
Yeah. So, I mean, it happens over time, right? Like that progress and that change happens gradually. At first, movement might increase discomfort, and that's expected. But over time, the brain really learns, like, hey, I can turn down this pain signal. Like, I'm safe.
And our goal is really about function. We really drive our treatment based on what the children want to return to. And a lot of times they've avoided their school, their activities with their friends, doing social things with their family, extracurriculars, sports. And so we really hone in on what do they want to get back to. And when we're really focused on what their motivators are, kids are really strong and resilient and they can really push through. And so our focus is really function. We don't so much focus on what number is your pain going down, but more what is your function can you do? Can you start to walk normally again? Can you return to school? Can you participate in your daily living activities at home? Usually this return to function actually happens before the pain is reduced, and the talking about the pain kind of becomes a secondary thing because we're so focused and motivated to return to our everyday life.
So, how do you motivate kids to be so brave to do a really hard thing? Either of you, both of you.
Like I said, we really focus on what the kids want, right? We're not gonna. It's hard to do hard things when you don't have the reward at the end, but when you can see the reward at the end, a lot of times the kids are great. They're very self-aware of the things they want to get back to. And so we ask them, what are some things you would do if you weren't in pain all the time? And usually they have a great list. And so we really focus on that. Physical therapy really is structured and very progressive in the beginning. We give them a very, very structured exercises and therapy, exercises at home. Like I said, we do a lot of cardiovascular exercises, walking, biking, swimming, all kinds of things depending on what that particular person is interested in. We do a lot of strength training to rebuild muscles that have lost their strength and endurance over time from not being used. We do a lot of functional tasks, things like getting ready in the day, helping with chores around the house, taking care of pets. And we do a lot of desensitization. So the tactile experience of how different sensations feel on your body and how those might be causing pain. And we always start small. We really talk about small goals, small wins, so the children can really build on their success.
Yeah, I'd say I'd echo that too a little bit, that, working on the things that matter most to them, right? Like their lives have been impacted a great or significant amount oftentimes when they get to us. And so by thinking about, okay, what does it look like to return to some of those things? They're very invested and willing to do the work.
So, and what role does counseling play? Is it a integrated part, or are you working on kind of different return to function goals?
Yeah, it's all integrated. So I think one of the big things is that people sometimes hear this addition of counseling services and think like, well, is it in their head? Like there's not an injury, there's not anything we see on a scan or when you're doing this assessment of their physical, right? But it's not really something that's in their head, or it's a really a brain process that we're targeting. The mental, physical, and emotional health are all integrated and they all need to be addressed, and they kind of all play upon one another. So we use CBT or cognitive behavioral therapy to reduce their fear of pain and address like what if thinking, and build coping strategies, because like Jess said, like oftentimes the pain doesn't decrease until after we've kind of started to reintegrate and to do things and function at a certain level that might be unfamiliar that we've reduced from. And so when you lock back into that or you start trying to reintegrate, having those cognitive skills and coping skills to be able to tolerate the discomfort is really crucial and important, but they all play together.
What can parents do at home?
Well, I'd say one of the most important things, and one of the most powerful parts of recovery is the parent piece, right? We all work together, and some helpful approaches that we suggest or recommend are really to focus on the function and not necessarily their pain. Just mentioned earlier, not we're not saying like, oh, what's your pain on a scale of 1 to 10, but we're thinking about like, okay, how do we let's get ready for school? How can we increase functioning? Encouraging normal routines, staying calm and confident and present with them, validating that while they might be experiencing some discomfort, that we need to focus on their functioning and what they can do and what is possible.
Inconsistency is everything. The kids have been functioning in one kind of lane for a really long time, and we have to shift that. And nothing changes if nothing changes. So parents really supporting their children. We give a lot of very structured recommendations, and it's hard for kids at first. And so really supporting the home activities that we're giving and helping the children build this new routine. Things like daily exercise, even when they don't feel like it. Working on sleep schedules. We talk a lot about nutrition and hydration and fueling the body with what it needs to return to its function. And then things like returning to school, returning to activities, hanging out with friends, things that children kind of naturally avoid because they're in pain. We want to bring those back in. And those social activities are just as important as sleep and exercise and nutrition.
Well, and I imagine, just in terms of, encouraging and helping kids get back to their routine, if they're afraid, part of the, parenting piece that I'm familiar with as a licensed psychologist is, helping families to not inadvertently reinforce avoidance or not step in to rescue a child too quickly and to really build those bravery skills. Is it the same mechanism for this, and is that hard for parents to do? Because my gosh, my kid's in pain, it must be hard to not want to step in and help.
Yeah, for sure. I think that that is one of the hardest parts when we work with parents is they want to, no one wants to see their child struggling or in pain. But like you said, right, like we don't want to accidentally reinforce and keep their functioning low because we're experiencing a little bit of struggle with watching them struggle. And so it's really important to support parents along the journey as well.
And is this an outpatient level treatment, or is more intensive treatment needed at times?
So we individualize our treatment recommendations as far as frequency goes, really based on the individual child. We can do something minimally 1 or 2 times a week. We can also do a much more intensive frequency up to daily. We do consider more intensive, frequent treatment programs when there's things in place like the child's in so much pain they can't go to school. If we've been trying the lower frequency and we're not really making as much progress as we'd like. If their pain is really severely limiting their daily life and we want to really rapidly kind of kickstart this progress, we might recommend a higher frequency of treatment.
Yeah, these programs are highly structured, several hours a day, sometimes for therapy, combining physical therapy, occupational therapy, and counseling. It can be extremely effective.
And what does progress look like? What could parents and kids expect from treatment?
As far as the physical side of it, we're usually looking at things like better movement, better endurance to participate in all the physical things that they need to on a daily life, return to normal activities, like you said, getting back to school, getting back to extracurriculars, hobbies, hanging out with their friends, doing social events with their families. And then overall, we do see a gradual reduction in their pain.
Yeah, and that's not always linear. I think on the counseling side of things, like being able to improve their ability to cope with this condition or the chronic pain that they're experiencing, I think that's obviously a big sign of progress there. Just cognitively how they're managing. But like I said, it's not always linear, and there will be some days that are harder, right? Like demands increase and decrease. Think about like summer break for school or like over the holidays when they're out, right? Those demands have decreased, and so we might see some progress there. And then once they return, it's sometimes we do see that it comes back or that there are flares or increases in pain there. So I think expecting that progress is not a linear experience, but the most important predictor of success is sticking to the plan, being consistent, even when it is hard.
Thank you both so much for joining today and sharing your expertise. Do you have any final words of encouragement for families that are encountering this really tricky, disorder?
I think the biggest thing we always tell parents when we first meet them with children with these pain conditions is your child can recover. They can get through this. I've seen kids go from barely walking to playing sports again, driving, going away to college, going to prom, returning to their hobbies and extracurriculars. It definitely can be done with the right treatment program.
Yeah, I think that's incredible. I think another thing is just being aware and mindful that you're not alone, right? Like we really work as a team and we wrap around our families that we work with. And even though it's hard, there is a very clear path forward. So yeah.
Thank you both so much. And to
Thank
all
you.
the parents listening, you're doing such a good job supporting your kids through this really hard and challenging, and we are here to help. Thank you.